I'm with Dr. Priya Dsouza today. She is a leading dermatologist and cosmetologist. You have a clinic that's called Epicorium Skin Clinic,
Yes.
HSR Layout, Bangalore. Welcome to the show, Doctor. Welcome to Fever 104 FM.
Thank you so much.
Is this your first time in the studio?
Yes.
Okay, all right. We are talking about skin pigmentation, especially a condition called melasma today. Doctor, we'll start talking about skin pigmentation because Skin Pigmentation Day is on the 25th of May.
Yes.
So we are raising awareness about some of the skin pigmentation conditions, especially melasma. My first question to you is, before that, could you please introduce yourself a little bit, talk a little bit about yourself?
So I'm Dr. Priya Dsouza. So I'm a lead dermatologist at Epicorium Skin Clinic, which is based in HSR Layout. So basically I'm from Mangalore. I finished my undergraduation and post-graduation in Mangalore, and now I'm in Bangalore.
All right. My first question to you is, what are the main causes of melasma and who is most at risk of developing this condition? Actually, let me be honest, it's the first time I'm hearing of this term called melasma. I didn't know about it. So basically the awareness is very less. And also I read up a little bit about it and I got to know that some people just treat it as a skin, small infection or, skin decoloration and stuff like that. But it's actually a condition, melasma. A lot of people are unaware about it. So let us shed light on what it is and what is this condition, who's at most risk of developing this condition.
So basically melasma is something where you get dark brown spots on the face, and it can also occur on the body. So the people who are prone for this is basically females, but even males get it. So during pregnancy you can develop this melasma pigmentation on the face, but eventually it disappears post-pregnancy. And other conditions where you can get this is people who are suffering from thyroid disorders, people who are on hormonal treatment or hormonal replacement, or having hormonal conditions, people who are on anti-epileptic drugs, and people who have UV exposure or exposure to artificial lights. And also people are prone to develop melasma if they have family history of melasma.
All right. So there are a particular group of people that are more prone to getting melasma than other people, but is there a chance that anybody can get it even without any of these family history and men who are at lesser risk or not having thyroid conditions? Anybody can get it?
Yes, anybody can get it depending on their lifestyle, how they are spending time, if they are more into the artificial lights or into the computer screens or outdoor activities where they don't take care of their skin, if they are not using sunscreen, yes, even they can develop.
Okay. How can someone recognize the symptoms of melasma? Like you said, it's dark brown colored spots on the face and rest of the body on your skin. What steps should they take if they suspect that they have it? Of course, other than going to the doctor.
Yes. So they will see has small brown dots which may look like freckles, or if you say sunspots. So they can appear on your cheek, on your nose, on your forehead, or where you have more exposure to sunlight or UV rays, I can see. So it may appear on one side of your face or both the sides, or it can distribute evenly throughout. You can appear suddenly on your forehead, on your cheeks, and they look more prominent when exposed to UV rays. So it will be darker than your normal skin color tone. So apart from this, you can also see sometimes very dark or very light depending on the type of melasma. So there are different types of melasma where you can have it on your jawline, you can have it on your nose, or you can have it only on one side. Sometimes it can misinterpreted as something else pigmentation. So you need to see your dermatologist to see if you actually have melasma or some other condition. There are many other skin conditions which can resemble melasma as well.
All right. It can, having dark brown spots on your face, on your jawline and stuff like that, it can have an effect. It can significantly affect a person's self-esteem, right? Can you talk about the psychological impact that this has and why it's important to address it? There is Skin Pigmentation Day happening on the 25th of May, and that is why we are addressing this. We are raising awareness about melasma and other skin pigmentation conditions. So why is it important to address it, and what is the psychological impact that you have seen in your field of profession that people usually have associated with melasma?
So when it comes to melasma, it's more of the appearance. So it can have a psychological impact, definitely. So it can lower their self-esteem, and since it's visible and it's a chronic course where melasma takes time to reduce and to maintain it for a long time. So definitely it can cause emotional instability, they can have stress, they can have anxiety and even depression in that matter. So it has to be addressed. It's not only treating the skin condition, the doctor must also address the psychological impact, like counsel them regarding the melasma, and also making them understand what melasma is and how to be treated, so that overall in future they don't get prone for more mental health problems.
All right. You touched a little bit about on the topic of treatment.
Yes.
Right. So let's talk about that a little more. What are the current treatment options that are available for melasma, and are there any new advancement in this area that people need to be aware of?
So coming to the treatment, first I would say is like topical treatment. That is, you have to use sunscreen, and then you have skin brightening creams, but prescribed by a dermatologist, not over the counter. You can go for kojic acid or niacinamide or vitamin C to start with. But if it doesn't reduce, then it's better to consult a dermatologist and get a proper treatment plan. So apart from this, you do have procedures. That is, you have chemical peels, where we apply a chemical layer which is concentrated and well observed, is what I would say. Apart from this, you have laser treatment as well. Now coming to advancements, yes, definitely there's a lot of research about melasma and how to tackle it, how to treat it, because it's a chronic course. Sometimes they don't respond to topical treatments. So you have new injectables, you have oral treatment, you have new topicals like cysteamine, you have azelaic acid which helps. Also you have microneedling, and PRP. So these are new advancement, and there are still further researchers, where the data has to yet come out and see how the results are with melasma.
Is there a particular age group that is more affected with melasma?
Yes, there is. So females are more prone compared to males, and also females with 20 to 40 years of age in between, because especially when they have any hormonal issues, even stress, depend on your work-life balance. So these are few reasons where you can get, and also sometimes even with exposure, nowadays there is a lot of computer screen time
exposure.
outside. Yes.
Okay.
So people tend to use sunscreen only when they go out. They don't use it indoors. So that's the main thing which I want to tell them, that you have to use. The word is photo protection. It's not sunscreen anymore, but it's a layman term, so we generally use sunscreen, so people think it's only during when you go out.
But they actually also need to protect their skin from the radiation that comes from your computer screen light as well, is it?
Right now where we are sitting, definitely there are lights, there is screens, so definitely you will have blue light exposure and infrared light exposure, so yes.
Sanvi, get me the sunscreen. Are there any preventive measures people can take to reduce the risk of developing melasma or managing its symptoms effectively?
Yes. So first of all, nowadays I think many people use sunscreens definitely, but they use it once, they don't reapply it. So I would say preventive measure best is using sunscreen 365 days, doesn't matter which season it is. And if avoid peak hours, that is I would say 10 to 4 p.m. That would be better. And in case you have to go out, use a scarf. Try to use a shade, or maybe umbrella would be better, or wide brim hats. Avoid if you have a family history of melasma, or where you feel you get tan more or something. Ideally prevent saunas, that's where there is generating heat, and also hot yogas, because heat can cause increase in your blood supply to your skin, and also you're more prone for pigmentation. Apart from that, especially when you go to kitchen, when you're cooking, so definitely that heat also, so you have to use sunscreen even when stepping into the kitchen.
Okay.
Yes.
Okay.
Apart from this, don't do home remedies, or don't use any irritants which can irritate your skin. So that's the reason where you can be more prone for pigmentation. Apart from that, if you have any hormonal imbalance, or do you feel that you're getting melasma, better to consult a doctor, so that if your underlying hormonal issues is corrected, you can prevent the melasma, definitely. Apart from that, maybe frequent visits with your dermatologist, so that they can tailor the treatment according to your skin type, so you can understand. Sometimes people do use over the counter, there's no harm. You can use the mild ones, like people nowadays, it's a trend of niacinamide, vitamin C, sunscreen, and there are so many things they explain.
Yeah.
But you need to understand your skin type. You can have reaction, so it's better to consult and get a tailored treatment based on your skin.
An expert opinion before
Yes.
you venture into. Okay, there are many myths surrounding melasma, just like there are because of Google, and
Yes.
like you said, people take a lot of over-the-counter medications because they just search it over the internet and they find some solutions that are probably like easy to get, right? So that also brings more myths about the condition and how it can be treated and stuff like that. There are myths surrounding melasma. Can you debunk some of the most common misconceptions? Because as a doctor, you would have heard many people come and tell,
Yes.
"Ki, I tried this and I tried that," and you must be thinking, "Oh, that's not the way it works." So, are there any common misconceptions about melasma? Can you please debunk those myths?
Yes. The first most common thing is melasma can be cured. No, it can't be.
It's
So
a condition,
Yes.
so you
it's
have to
a
just
condition.
manage it.
Yes. So
Okay.
it's a chronic course. You have to manage it. Basically with the treatment and the protective measures. Second one is home remedies work for melasma. So many people is like, doctor, I've used this, it's reduced. So melasma sometimes what happens, it goes on its own, but it also comes. The only thing is home remedies, there is no backed up research. Our medical treatment is evidence based. So definitely this will have more effective treatment than compared to your home remedies.
But there are home remedies. Isn't
There are home remedies. The thing is, the creams what we use, they are extracted from fruits, they're extracted from different kinds of plants and all of that. But we know the concentration, what is present. They don't know the concentration. So what happens, it can be more acidic and they can irritate your face. So definitely that is why we tell them, to avoid these home remedies. Apart from that, using only sunscreen, it's not the only thing which helps you to prevent melasma, but you also need to take care, especially like as I mentioned earlier, like brim hats, using shades or using umbrella. These are few things. Apart from this, once melasma goes, it doesn't come back. No, it does. Melasma is a chronic cause and it can appear anytime. So many people have this one more myth that laser treatment can worsen melasma. So laser treatment can worsen if it's not done by a board certified dermatologist. Yes, if you get it done anywhere else, who doesn't have the knowledge about lasers, yes. Otherwise, laser treatment do work, and they are the next step of treatment if creams don't help you with melasma.
You said board certified dermatologist.
Yes.
Okay, so someone needs to check that before they get the laser treatment done for melasma.
So basically, dermatologist has in people who have done MBBS, MD in dermatology. They are the right person where you can get this laser treatment done.
Okay.
And not somewhere in parlors or,
Sure.
sometimes even aesthetics, they say where they wouldn't have done, MBBS, MD course. Definitely not.
All right. Many people use over-the-counter steroid creams as fairness treatments, which can lead to serious side effects. Could you explain the risks associated with these creams and why they should be avoided? Can they cause melasma as well?
So definitely it's good that you brought up this question. So over the counter is something which I have come across common names where patients or people who use it. So Skin Light, Skin Shine, Pakistani creams, Betnovate creams, or triple combination, where I would want to mention this so that people know that they're not supposed to use this. You will have this triple combination where you have mometasone, you have hydroquinone, and all of a few. There is multiple combinations. So they would go to a pharmacist or they would go somewhere or a friend would recommend, use this, it will get better. So what happens is when you use it, definitely the melasma reduces, but they don't know the effect what it causes.
Okay.
So it's like you're addicted to this cream. The moment you stop, the melasma comes back even more worse.
Okay.
So what we were supposed to treat it in an earlier, easy way, it becomes more difficult for us to treat because your skin starts to get damaged. Your skin starts to become thin like a tissue paper when you keep using this for a long, chronic period.
Okay.
So also you can develop excessive hair on your face or wherever you have applied. You can see your underneath blood vessels because your skin becomes so thin. You can develop pimples. You can have sensitivity. Even when you step out to sun, you can have lot of redness of your face. So when these things happen, it takes a chronic course and patient also get frustrated, when melasma is coming back. And the thing is, we have to withdraw them from the creams, which takes a longer time. And then definitely we'll try to reverse as much as possible the damage. But that's why I would advise not to use such creams or don't go and buy, skin brightening, skin light creams. Better would be just start with the sunscreen, and maybe I would say niacinamide or vitamin C would be better than using these creams.
You said you used the term Pakistani creams. What does that mean? It's like is this the cream to get the Pakistani fairness? Is this what?
Yes.
Okay.
So basically, yes. The thing is, the creams are named something like Pakistani, where you have instant fairness cream. So they don't mention the ingredients.
Okay.
but you become unusually fair than what you're supposed to be.
Okay.
So that's when you come to know that there is something in this, and you have to test these creams. You have to see what is the content, which they never mention. For that, we have to go through laboratories and get it checked.
It causes more damage than it does
It
good.
does. It gives you that instant fairness, but yes, it definitely causes more damage to your skin. You don't want to damage your skin for sure.
All right. Final question to you. What advice would you give to someone who has been diagnosed with melasma or is struggling to manage it, along with, other than coming to Epicorium Skin Clinic in HSR Layout, Bangalore? Are there some things that people can do on their own, and what is the advice that you could give to someone who has been already diagnosed with melasma?
So definitely, if they're diagnosed with melasma, first thing would be protecting your skin. That is morning till evening, even if you have a longer screen time, so definitely use it till then. Use a sunscreen of more than 50 SPF. 30 is the baseline, but 50 would be better because you have more prone for melasma. So 50, and reapplication every 3 hours once is what I would say. And if you're going for outdoor activities, at least half an hour before you apply it, and then you go and reapply if you're more than 2 hours in the outdoors or in the swimming pool. Apart from that, maintenance is very important. So once they start using, medical line of treatment, they start using creams, any cream in that matter, like, if they are maintaining regularly and they're not getting melasma after that, don't stop it. The moment you stop it, what happens is your melasma can come back. One more is patience. Patience is the key here. It's a lifelong process.
Yeah.
So until you want a beautiful skin, you have to maintain with creams.
You have to keep at it.
Yes, definitely. So you have to maintain it as a chronic course. People do get frustrated, doctor, for how long I have to use this cream, or I'm tired of using. I was like, you have to use it 365 days. You have UV exposure, and you have so many things going on, your lifestyle, your the way you live, your work. So that is never going to end. So definitely this will also never end. Apart from this, if it doesn't get better with the creams, there are various treatment options available. So it would be better if you consult, go one step ahead, because only cream sometimes there is melasma where it is resistant, which doesn't respond. Even if you give different kinds of combination, it doesn't. That's when lasers come, chemical peel comes, you have injectables. So definitely it doesn't go in one sitting. You have to do multiple sessions. That's how it's a multimodal approach, I would say, where we tailor the treatment according to it. But apart from that, at home, sunscreen and any skin lightening creams, I would say, not over the counter like steroids, maybe milder versions like this kojic acid or niacinamide or vitamin C to start with. If that doesn't help you, then I would advise go a next step ahead, maybe visit a dermatologist, I would say.
All right.
Yes.
A small message to whoever is listening for Skin Pigmentation Day. It's on the 25th of May.
Yes.
Any message you would want to give from your end?
So I would say protect yourself as usual. That's my favorite sunscreen. And apart from that, if you have any sort of pigmentation, to start with the sunscreen in the morning, moisturizer in the evening, and do your regular routine. Don't over exfoliate yourself, I would say. Maybe go for a gentle cleanser if you have a sensitive skin. If you have a very oily skin, go for a more of stronger like AHS, BHS. Sometimes nowadays everybody uses that. So apart from that, take care of your skin, stay hydrated, and that's it.
Thank you so much for joining me. That was Dr. Priya Dsouza, a leading dermatologist and cosmetologist, and you're working at Epicorium Skin Clinic at HSR Layout.
Yes.
Thank you so much for joining me.